let's talk about technique with Tuff-Temp Plus.
Yes.
What do dentists need to know about clinical technique for this material?
Most important thing is have a matrix. And I think your dental assistant can be part of that team to make sure you have that matrix. Whether your assistant takes it or insists that you take it before you start with the prep. Because this sometimes can be busy, you get somebody numb, you leave, you come back, and you forget to take that. And then you have a more difficult situation. Not impossible, there are ways to work around that, but why make life harder when you can make it easier? And that's what I liked about Tuff-Temp, that it's more predictable. So you get a matrix first, and get a good matrix. Some dentists would like to use maybe an alginate. It's cheap, it's fast, but what if the patient does have a problem with the temporary? What if the crown doesn't fit well and you had to cut off the temporary? How do you make that temp? So I take a medium body, very fast set, polyvinyl impression in a little tiny tray. We put in a plastic bag with the patient's name, a tag, and a date. We store it in alphabetical order in the lab. In case we need it, we pull it out and we have it.